Thank you for staying with us on TVC Breakfast. Let's talk health now. And, our discussion or our attention this morning is centered around childhood cancer, one of the medical challenges in the world, where thousands of children are diagnosed of different types of this disease yearly. And sadly, many of these children die due to late detection and poor handling. Proper nutrition has also been identified as important in preventing childhood cancers. And parents are advised to feed such children with healthy meals and pay attention to their health. And that's what we'll be talking about now. We have with us head of program, the Dorcas Cancer Foundation, Korede Akindele. Thank you for joining us on the program this morning. And of course, the whole of September is usually earmarked for driving awareness on the issue, the very serious issue of childhood cancers. But, in terms of this year's direction, what should Nigerians know about? Because we understand that a number of Nigerians, are dealing with, the realities of having children who are suffering from childhood cancers. But how do you work with, such parents?
Okay, thank you very much for having me. So let me start by the first question, what should Nigerians know about? We want Nigerians to know that the narrative of childhood cancer is beginning to change from what we used to say before. Now we have access to care, we have access to experts. Things are beginning to go differently, like the way people think before. And for parents going through this trauma, it's trauma, that's what I can say, because no family should be allowed to go through cancer. Nobody, cancer is not something you wish for anyone, but especially when we talk about children. And so when a parent have a child that goes through it, the first thing we let them know that, look, it's not a death sentence, and then this child can survive it. That's what it is. Yes, there are treatment protocols that must be followed. There are challenges, there are side effects during the treatment, but we've been able to see results of children that have gone through this, and now they are survivors. So that's what we try to let them know. You're not alone. All you need to do is to just go through the guidelines of your medical practitioner, and then you see your child coming out. And like I said earlier on, the narration is changing. We're having better access to care. We're having more development among our professionals, and things are beginning to change from what we used to see 8-7 years ago.
But in all of this, now when you talk about childhood cancer, first of all, many people do not understand that leukemia is a form of childhood cancer. And so in a country where a lot of people embark on out-of-pocket payment for medical care, how do people cope in terms of getting access to care?
All right, thank you. The truth is, everywhere in the world, cancer treatment is expensive.
Definitely.
So we can't say, okay, because this is part of the world. And so what's happened most times is people resort to organizations such as ours to be able to help them go through this journey together. We understand the kind of environment that we are. And even in the adult cancers, there is an indigent fund by the federal government to be able to cater for some people. But we hope it will come down to childhood cancer, because we are so glad that childhood cancer has been involved in the National Cancer Control Plan. And so we know such benefit would definitely come to children. And so for people going through this, they resort more to help, family help, to organizations such as ours. And I would say to you that Nigerians are good people. Nigerians, they support each other. I work in the space. I've seen the way people support. So it's out of pocket, it's expensive everywhere in the world, but we have supporters, and that's one of the roles that we play to bridge this gap so that we can reduce the burden on this parent. Yes, we cannot do everything, but the ones that we can do, the support that we can give, we come in, we fix it, and we go through the journey together. And today I can tell you we have survivor stories that we can talk about.
And then there is also the notion that, treatment of cancer is best done abroad. But I want you to specify on how far we have gone in, achieving effective treatment in Nigeria.
Okay, thank you very much. We have gone very far now. For example, let me say in Lagos here, we have a new ward at the Lagos University Teaching Hospital, which is that was just dedicated, and it's a old pediatric oncology ward where the expert is. In Nigeria now, even yesterday, I mean, we were having a discussion, launch around pediatric radiation oncology. So we have radiation facility that cater for children now in Nigeria. So unlike before, yes, we have low, we don't have up to what we need.
And
but
there may be a queue of needs.
But we have the patient, we have the professional, we have the population. So we are beginning to have more development, even for these people. There are programs. I mean, we all understand the travel syndrome, the Jaguar syndrome. So we try as much as possible to even bring developmental programs to be able to develop their experts. Because one of the things people say, I want to go and develop myself, I don't have access to more education. So educations are available now that connect them virtually to be able to say, we have a cubed ward facility. I know in Lagos, I know in Abuja, and I know in some other states. And we have pediatric oncology. Yes, the numbers are still few, but we have development. We have radiotherapy machine that's cater also for children. So though there may be queue, and there are amazing discount being given to children, courtesy of our partnership, and so these are the things, some of the things that we have now that makes the work easier. There is correlation between, so a child, for example, in Lagos, if a child is being treated in one of the facilities in Lagos, okay, he doesn't need to travel out of that hospital before he could get radiotherapy treatment. All he needs to do is when it's time for radiotherapy, you move from one section to another building, and then you get what you want. So it's changing. We are not there yet, but I kept saying that I know how it is.
We're better than we were before.
We are better than where we were before.
So looking at childhood cancer now, what are the danger signs that parents should look out for?
Okay, so unlike adult cancer, you cannot pinpoint and say, you know what, for breast cancer, you can say, okay, if you see a lump or cervical cancer. So, but for childhood cancer, it comes like a natural illness. But what we try as much as possible to let every parent know is your child health is important. Childhood cancer presents itself like a normal illness in a child. For example, you talk about leukemia, which is one of the cancers, and it is it comes like maybe repeated infections and stuff like that. So when you have a child that is not is sick and not getting better, please make sure you ask for a referral if you are not getting the best treatment where you are, and let a pediatrician see your child. It's something I talk about, and I know it is not every one of us that could go and see a pediatrician.
But how far with early treatments, early diagnosis?
It goes a lot. Any cancer,
right,
either it is adult cancer, children cancer, early diagnosis goes a lot. And not just early diagnosis, proper treatment. And let me use this opportunity, I think, as we have to just charge everyone that has a female child between the age of 9 and 14. I mean, there's a cervical cancer vaccine rolling up. Please ensure that you get your female children to be able to take
from ages of
9
okay,
to 14.
All right.
It's a breakthrough for us in Nigeria, and so we try as much as possible to add it to part of our awareness this month to let people get it in primary health care center.
And concerns about safety?
Safety, yes. Yeah, it is preventing them from having cervical cancer.
Right, but concerns about safety of the vaccine itself, because we also have some people who say they are afraid. We saw how it was with COVID.
So because of COVID, a lot of people got aware of the fact that some vaccines might not be safe. And so,
right.
You see, for now, I mean, we've seen the result in other parts of the world. We've seen the result in other parts of the country. So it's safe. Please don't. It's better to be safe than to have a regret. So don't look at the adverse and say, oh, something is this. Take your child there. We've seen it work in other parts of African countries, and we've not had any negativity around it. So please make sure you take your girl child in that age range for this.
All right. Thank you very much, Korede Akindele, the program officer or the head of program at the Dorcas Cancer Foundation, and you've said, so much, some very positive news there, that though we are not where we want to be, but we are much better than we were before. We thank you for the work you're doing, and we hope for more good news from your end in tackling decisively the issue of childhood cancers. Thanks again for your time
Thank you.
with us.
Thank you.